Another common fear which any patient with hernia has is, doctor, you are going to do my hernia operation, will it come back again? Because I have a relative, an aunty, who underwent a hernia operation 5 years back, and today she says she has got the hernia back. I have also heard similar stories from my friends. So everybody is discouraging me from going for operation, saying that what is the point? If you get it done now, it is going to come back after 5 years or 10 years. So will I get my hernia back? The short answer is it depends. Long answer, depends on what. Hernia repair is an operation where we try to recreate the weak abdominal wall using reconstruction of the muscles and also using a mesh. But the final success of the operation depends upon multiple factors, because when the healing is good, the scar is healthy. When the scar is healthy, the hernia does not come back. So what are the factors which will decide how successful is your hernia operation going to be? There are certain factors which depend on the patient himself or herself, and there are certain factors which depend on the treatment. Patient factors include patients with diabetes. They have very high blood sugar, their tissues are quality is poor, the healing is poorer, and if they don't maintain a good sugar control, the scar tissue which forms is going to be weak, and patients with diabetes can have a higher rate of the failure of hernia operation in the long run if they do not maintain a good sugar control. Obese patients who are extremely obese, their muscle mass is thinner, or if the patient gains a lot of weight following a hernia repair because of excessive stretching, the scar tissue is pulled, stretched, and thereby the hernia repair can give way. Smokers, the quality of the cement, the body scar can be referred to like a cement. So the cement which the body produces to heal any wound, the quality of that cement or collagen is directly affected by smoking. So if a patient continues to smoke after a hernia repair, the quality of the scar is very poor and the hernia can come back again. Patients who have received previous radiation therapy, if they have received radiation for any sort of cancer, the tissues are generally damaged by the radiation and these hernias can recur again. And there are other factors like patients who have chronic severe coughing, or patients who do very strenuous activity very early after the hernia operation. These patients can have weakening of the scar. The second group depends upon the treatment. What sort of treatment was done? Was the repair, what is the experience of the surgeon? What is the technique which was used for the hernia repair? Was the technique appropriate for that type of hernia? Like as I told you earlier, certain hernias are best treated laparoscopically, certain hernias are best treated by open surgery. If the surgeon chooses the right operation for the right patient, the chance of success is very high. Then was there a mesh put? A mesh was used to reinforce the hernia or not? If it is used, what sort of mesh has been used? So these are all the factors which will contribute to the final result of whether the hernia is going to be cured forever or if it is going to come back after a few years. So there is no simple answer to this question like if I do a hernia repair now, will it come back again? It will depend upon so many of these factors, and that will be individualized. So generally the result of an operation is usually discussed with the patient prior to the surgery, where we assess all these factors and give them a rough estimate of what is the chance of success of a hernia operation.